joining us right now is Dr. Michael Papsidero, who is an ear, nose, and throat specialist. I won't even attempt the right title of that. How do you say it?
Otolaryngologist.
I'd never get it. I never get that. We're going to be discussing chronic sinusitis. Is that how you call it?
Yes, it is.
Common sinus problems.
Common sinus problems, and
which a lot of people in this area have.
Yeah, I think a lot of people actually around the United States have sinus disease. It's actually the most common chronic illness in the United States. We usually think of emphysema or arthritis as being more common, but when you break it down in certain ways, at least, there are probably about 30 million sinus sufferers in the United States.
Is that right?
It's a very common problem.
Before we get into this particular ailment, which, as Mike said, that is very, very prevalent throughout the United States, can you give us a little background on you, since you're kind of new here, right?
Yes, well, new to this area,
yeah.
Immediate area. I've been in Cleveland for many years. I was born in actually Buffalo, New York, or just outside of Buffalo, in North Tonawanda, New York, and ended up living in the Cleveland, Ohio area for much of my childhood. Went to Case Western Reserve University, and then to the dreaded University of Michigan for medical school and for advanced training in otolaryngology. Came back here in the 80s and had a practice with 9 other partners for a number of years. I was also a vice president with the Cleveland Clinic Health System for a number of years as well, and then decided to get back to my roots and really just take care of patients in a community setting. Happened to know the CEO of Ashtabula County Medical Center, Mike Kabowski, and it seemed to be a good fit. So came here early part of the summer, and really have enjoyed getting going.
Good for you, and welcome. That's a great thing. Are you living in Ashtabula, or
I have a house in Ashtabula that we're renting, and then we plan to buy as soon as we sell our house in Chagrin Falls.
Oh, I know how that goes. I know how that goes. Well, that's great, because I don't know. To be honest with you, Mike, I don't know whether they had a specialist there before.
Yeah, I think they had specialists. They've had specialists intermittently over the years. Some ENTs for a number of years at a time, but sometimes as little as 1 or 2 years, and they've come and gone. But over the last year or two, there hasn't been anyone working predominantly at the hospital, and I honestly don't know why. I think it's proven to me to be a great community. The patients are wonderful people. The facilities are outstanding, and I've been able to do everything there that I had been able to do in the Cleveland Clinic primary hospitals, and so yeah, I've enjoyed it a lot, and my associates, other physicians, have been great as well. Really enjoyed them, and was pleased to see the quality that exists there.
I told my wife I was looking forward to talking to you because last week, 2 nights in a row, at exactly 20 to 9, I started a sneezing jag, and I could not stop. It was like something was coming in the window that I was allergic to or something. Mm-hmm. And this time of year, as you know, there's all kinds of things flying around in the air, you know. And I sneezed so bad the next morning I could hardly talk. It just wouldn't quit. Is that considered? Would that be considered an allergy? And is there a test that I could take that would find out what that is?
Well, it could be an allergy. I think it's always the challenge is to identify really what is the cause of those kinds of symptoms. And if it were an allergy, if we were to do an examination and a history and really get into the detail and decided that there was a fair chance it was an allergy, this time of year it's often ragweed, mold, are the 2 largest culprits, and we could do a test. It's a blood test that I tend to use. There's 2 ways of approaching allergy testing. One is to use a blood test which is called a RAST test. It's short for a very long name. And, and the other is to do skin testing. And both are for the purposes of allergens that we think about, allergy to flowers or to grass or trees, mold, ragweed. Both work quite well. Typically we will use the RAS test, and that'll tell us if the patient is allergic. If they're highly allergic, there are different approaches. I mean, some are medication. We have a lot of good medications now, from nasal puffers to certainly antihistamines, and some sometimes we'll use shots, certainly the minority of the time.
Really?
At times people have asthma or other conditions and they really need a lot of help, and so we do the full court press more or less and do shot therapy. But the majority are managed nicely today with medication.
With your chronic sinuses, you mentioned that it's quite common throughout the United States. How common?
Well, throughout the United States, it's certainly it's the most common chronic illness. It's affects about 1 in 10 people. That figures out to more than that in terms of adults. So we see it all the time. Now, I think you have to kind of differentiate between having, quote, sinus. Lots of people complain of sinus, and sinus being just pressure in the face and kind of a mild headache and a little sense of fatigue or just being out of sorts is a very common thing. And that is more common as you get close to, in this case, the lake. The little microclimates and barometric changes that the meteorologists are always talking about do affect people, and that kind of sinus is probably even more prevalent. As you get about 40 or 50 miles from the lake, that diminishes. And of course there are different places in the United States where they have similar effects. But then when you get into the issues of infection, whether it's an acute or sudden infection of the sinuses, or chronic, which is a long-term infection of the sinuses, that's a little different story, and that's what I was referring to as a chronic illness. So you can go from just being uncomfortable because of sinus, which will happen with, anytime you see these Alberta clippers come in, or even just weather, rain or weather coming in, and you know that people who have sinus will be affected. But then there are those who typically will have a cold or perhaps allergy, and it's simply lasting too long. A cold should last maybe 14 days, some symptoms of a cold. 10 to 14 days, it can be reduced by doing certain things, but generally that's the typical case. But if your cold lasts longer than 2 weeks, then you very well may have gone from a viral illness to a bacterial illness, which would be an acute sinus infection. And that will linger. Your body can fight it off over time, but it's probably
so
more
there
helpful.
is a difference between a cold and a sinus infection.
Oh, much.
I guess I didn't know that.
Yeah, colds often precede sinus infections. Colds are viruses. They're a whole host of viruses, which is one of the reasons we can't make a vaccine to it, because there are too many viruses that cause the symptoms of a cold. Symptoms of cold are similar to, for instance, allergy, but they're time limited. Your body develops antibodies to the virus, and over the course of, again, 10 days to 2 weeks, it fights off the cold. But if the symptoms of runny nose and facial pressure and drainage, feeling out of sorts, maybe fever, last longer than 2 weeks, then you probably have a bacterial sinus infection that happened because of the cold.
Is that antibiotics, would that work?
Yeah, well, treating acute sinus infections, the ones that happen after a cold, are typically we would treat it with antibiotics, especially if that's the principal symptom. If you haven't spent the last 5 years fighting off quote sinus,
right.
Then yeah, antibiotics, decongestants, steam, moistening, using saline sprays. Those are all good things to do in treating infections that are acute or sudden. We call them acute if they're occurring within a couple of weeks. And as time lengthens, then we move into the chronic phase.
I guess you kind of touched on it, the characteristic signs and symptoms of, let's do both, look, the chronic and then just regular sinus. Like sometimes I've gotten in here, an ache in there, in a stuffiness. I would imagine that's just sinus, right?
Yeah, that would be a really, I mean, the formal name of many times people have those symptoms, and they're really what's called vasomotor symptoms. They're symptoms of swelling in the sinus and in the nose, often due to weather changes, irritants in the air, that sort of thing. And that you feel that as a pressure, as a congestion. Sometimes you'll get a little headache. If it persists, sometimes you'll really feel out of sorts, and it's just not having a good day. But that's not necessarily an infection. When you start getting drainage that's yellow or green or not clear, let's put it that way, that would be more indicative of an acute infection. You get a headache with an acute infection very frequently. You'll feel more intense pressure in your face, and that would be more indicative of an infection versus quote sinus, which we all suffer from more frequently. And then, so the acute phase will have headache, drainage, facial pressure, pain, nasal congestion, which is very similar to a cold, but as I said, a cold is time limited. Then if it were to continue for a longer period of time, what will happen is you can get recurrent acute infections, but there's an infection percolating along inside your sinuses that settles down. You don't feel quite as bad. Maybe some days you feel a little out of sorts, you feel a little pressure, but you don't have headache anymore. It's with chronic sinusitis, you usually don't get headache unless you develop an overlying infection that happens to occur. So one of the differences between acute sinus infections and chronic sinus infections is that the headache tends to be less. It's hard to determine that you have chronic sinusitis. If you have recurrent symptoms of pressure, headache, nasal congestion, then you might, on examination, show, when you're seen by a physician, show that you have chronic infection there. The gold standard for determining infection is, well, there are really two. One is to do a careful exam in the office where we can look at the nasal tissues with lights, special lights. And the other is a limited CAT scan of the sinuses, which we've developed a more limited form of CAT scan, which limits the amount of X-ray radiation that you have to be exposed to, just to give us a quick look at those sinuses. And that'll tell us if you have a chronic versus an acute infection. Chronic infections, the question is, do you have to treat them all? And the answer is no. You don't have to treat them all. It's really a function of how serious your symptoms are. If you keep getting, if you're constantly feeling fatigued, if you're constantly having headache or facial pressure, if you get recurrent acute infection where you're seeing the doctor all the time for antibiotics, then you need to check for chronic, in fact, chronic sinusitis. And in that case, we can sometimes treat medically, and sometimes we have to treat it surgically.
Really?
Yes.
I have to get into that now. So, I mean, if you're constantly blowing your nose or constantly stuffed up, you certainly wouldn't want to go through your whole life like that.
I don't think most people would. It's pretty uncomfortable. It interferes with
It would go away.
life.
It goes away. That infection goes away, correct?
Yes, usually the acute infection goes away.
Okay, we just had a pharmacist on the show here, Tracy, and her big thing is to keep the flu away, the chest colds and all that stuff away. Keep washing your hands. Does the chronic sinus problems or the infections have anything to do with that kind of stuff?
Not at that stage. I think it's good advice, particularly in the winter, because viruses are transported between people commonly on the hands. And certainly at the hospital, one of the key elements of reducing infection, or certainly transferring infection from patient to patient, is hand washing. It's actually sounds like a simple little thing, but it's become a major effort. And if you notice in going to hospitals, all over the place you'll see Purell type devices.
Right.
And the idea is to remind people and to have them use these to minimize the chance of spreading infection, which is a large goal right now. And we've been effective at Ashtabula, more effective actually than most hospitals in the state. And I think that's a tribute to people who are really trying to get the best care for their patients. So yes, I couldn't agree with her more. Hand washing is important, particularly if you have kids in the family.
Yeah.
I mean, with kids, especially now they're back in school, this is a time when kids start getting sick. And
that's what she was saying about her own. You know,
Yeah,
they bring it right home to you. You know. What's this little fella here?
Well, I brought this along. I'm not sure how well this projects, but it's to demonstrate a couple of things. It shows all of the sinuses, and there are basically 7. There are the 2 cheek sinuses, or maxillary sinuses. This is the nose. I don't know if you're able to get a good shot of that.
See right there, Mike.
Oh, I see. Yeah, good. Well, so here is one of the maxillary sinuses. This I've got red-green color blindness, so I think that's blue.
It's blue.
I think it's blue. And I think this is purple up here, and these are frontal sinuses. They're up in your forehead. And then there's a sinus, let's see, we can show in the back of the head.
Yeah.
There's a sinus that goes from the front of the nose way back into the head, more or less, and it's called the ethmoid sinus, these green areas. And they're often the culprits in chronic sinusitis. And then way back here, just under where the brain sits actually, is a single sinus called the sphenoid sinus. And that one is particularly difficult to deal with. It is often the cause of chronic headache, and really requires some attention with antibiotics and sometimes surgery to alleviate chronic infection there.
Mike, now you mentioned surgery to get rid of some of these problems if they can't do it with medication. What do you mean? I mean, what do you do? Do you take anything out that needs to be taken out?
Yes. Well, it really, everybody is different, but the surgical approaches that we use are defined a lot by the results of the CAT scan. If the CAT scan will show you where the disease is within those sinuses. And what we do since 1987, at least in this country, we have been using a technique called endoscopic sinus surgery. Prior to that, many of the approaches to sinus were open. There were incisions made on the face. They were more radical, if you will. With endoscopic sinus surgery, we use a small endoscope. It's a small rigid endoscope. It's probably 3 millimeters approximately in diameter. And we're able to connect that to a camera and visualize all of the sinuses as we pass the scope in the nose. And for my benefit, it's hooked up to a camera and then a monitor, and the monitor enlarges it so that those of us whose vision is slowly going a little bit can see it better. And actually, it does a great job of identifying where the abnormal tissues are and allowing us to gently remove those abnormal tissues without removing normal tissues. Typically, this is an outpatient procedure, whereas before it used to be inpatient. People were in the hospital for days. And now it's in and out.
Isn't that amazing how things have changed?
It really is, and this is probably in our field, ENT surgery. It's been one of the most important changes ever, really. It allows us to successfully treat a severe condition. Many people have, for instance, polyps too, which are like grapes growing in your nose, believe it or not, and those we can take out without injuring any normal tissue. So we can preserve the normal, which is what you want to do, and you want to give the normal tissue, the lining, the mucous membrane, so-called mucous membrane, the ability to grow back and replace the abnormal. And then you can actually get a cure or a marked improvement. In the old days, we'd strip it all out, but many times the abnormal lining would just grow back in. And then, 5 years later, you were back where you started. This is a tremendous advance. It's done with very little pain. Post-operatively, I don't use packing except occasionally, and you've heard horror stories about people having packing in their nose removed and so forth. So this has made a big difference, and it's a very valuable addition. It gives us an option that we can use on patients who aren't end stage. Before we would not do surgery unless people just absolutely were at the end of their string. But now we can say to people, we can help you out before that point. Now, you don't jump to surgery right away in anyone, really. You treat them medically, you try to get things resolved without endoscopic intervention.
You are a surgeon then, right?
Yes.
I had a buddy that has the polyp thing, and he can't breathe, he can't taste or smell.
Right.
And he does tell me, though, if you just put on steroids for like 3 or 4 days, the smell comes back temporarily.
Right. Steroids can be really helpful because steroids are anti-inflammatory, and inflammation, which is basically defined as a condition where in this case where the lining is irritated, reddened. It has certain chemicals in it called histamine and other chemicals which cause a reaction of the lining. So the lining tends to get thick, and over time it'll form these globules of polyps. And the polyps then occur up high in the nose. I don't know if people can see this, but it's up high in the nose. So up high in the nose, you also have your ability to smell is largely up high in the nose. There are special nerve cells to take that to the brain. Of course, the tongue plays a role too, in the mouth. But so when you're able to shrink those by reducing the inflammation with steroids, it allows a temporary period of relief. It may even allow things to drain properly, and certainly we will tend to use those initially in people with polyps. The problem is that once you stop the steroids, they come back, and corticosteroids are a medication that you can't really use frequently,
right,
because they have side effects of their own that are not good. So the polyp patient will typically eventually come to have endoscopic sinus surgery where we can actually remove the polyp. We've got, in most cases, most situations, about a 75% chance of marked improvement or cure with the endoscopic. It is simply how some people react to chronic irritation, and very commonly seen. Another thing that's commonly seen is people often have ear pressure and popping in their ears. You get it when you have a cold, sometimes you get it when you have severe allergy, and you get it when you have sinus. And the reason is that the sinuses are connected to the eustachian tube. If your ear is out here, I'm not sure if I'm showing this, but anyway, the ear is out here, the eustachian tube is connected to the ear and goes by and opens up near the sinuses. And it's that eustachian tube, which is the tube that clears the pressure in the ears. So if the sinuses are inflamed and swollen, eustachian tube is often inflamed and swollen. So people find that they're trying to pop their ears or open them. And it's safe to do that. Most people think that maybe they're going to blow a hole in their eardrum or something by trying to pop them open. It's perfectly safe. You can't do that unless you've had severe ear trouble in the past. But it's temporary if the sinus problem doesn't go away.
You know, we haven't talked much about ear situations. I remember when I've only been on a plane once, it was years ago, but I had the pressure in my ear, both ears, for like a couple of weeks before it went away.
Yeah.
Is that normal for that long?
No. It may have been that you had some pre-existing swelling in your sinuses or in your ears for some reason. Maybe you were getting over a cold, or maybe you were had a sinus infection that was resolving. So there was already a tendency for these eustachian tubes that drain the ears to be kind of swollen and not functioning really normally. And then you get on a plane, and planes are pressurized to about 3,000 feet. So you go up, and that's not so bad, because as you go up, the actual surrounding pressure goes down, so you don't feel it that much. But when you come down, so you've been up at a high altitude for a period of time, your ears and body have adjusted to that, and you come down, and all of a sudden the pressure around us, just like you were diving deep in the water, much the same, as you come down to sea level or near sea level, the outside pressure increases, and it presses in on the ear. Excuse me. And if your eustachian tubes function normally, it'll clear it. It'll open up and it'll equilibrate the pressure. But if they're not functioning normally, what happens is you get a stuffed feeling in the ear, a pressure feeling, because the inside is a relative vacuum relative to the outside. So until the eustachian tubes clear that, it's going to feel that way.
Yeah.
Now we can help that. We can help prevent it by putting you on some medication. Sometimes for people that have significant problems, I'll give them a short course of steroid beforehand.
Really?
If you've got to fly, you know, couple 3 days beforehand, take some a Medrol dose pack or something like that. Decongestants beforehand, and just before the flight. Sometimes nasal spray just before you get on, like Afrin spray, decongestant spray, can be of help, because again, the spray can extend through the nose to the opening of these eustachian tubes. So those kinds of things can be good preventive measures before a flight if you're troubled by flying, or if you're traveling in the mountains. Some people are troubled there. There are preventive, simple medical preventions. Now, if you have this condition, which is called barotrauma, don't ask me why, but that's why it's called barotrauma. And if it persists, let's say more than 2 weeks, and it's really bothering you, and medication doesn't work, we can do what we do with little children. We can put do a myringotomy, which is a little slit in the eardrum to relieve the pressure. We can even put a tube in for a period of time until.
Heard of that? Yeah.
Yeah, and we do that in kids because children have a problem with their own eustachian tube function. Until they grow older, the muscle that opens the eustachian tube is at kind of a weak angle. It can't exert a lot of force. So some kids are just very prone to pressure in the ears and infections.
And that causes colds or infections or something, right?
Yeah, it's a lot of middle ear infections and pain and hearing loss. And
I remember one of the boys that I raised had that.
Yeah, it can be a problem, and the tubes are a pretty easy solution. I mean, it's a short procedure at the hospital. They do, children, adults don't have to be asleep, but children do, and but they're lightly asleep for about 3 minutes or 5 minutes, and it does wonders. You know, I just constantly have parents letting me know that their kids, you know, now they're speaking better because they can hear better, or they're doing better at school, or whatever. But it's kind of one of the more rewarding procedures, even though it's a little tiny thing, because you get such a nice response, and you hear such nice things.
It's an important one. One last question for you. Q-tips. People
Yes.
cleaning their ears out with Q-tips. Are you one of these doctors that did not believe in using them?
Well, I think the issue is really how you use them. I think Q-tips Q-tips are just fine if you use them out in the outer ear and if you don't stick them in the ear canal. But if you stick them in the ear canal, several things can happen, and almost all of them are bad. It's kind of like the old Woody Hayes, if you pass a football, you know, 3 things can happen, and you know, 2 of them are bad. The problem with the Q-tip is, if you remember the old cannons where they'd plunge the ball into the cannon shaft, you're pushing wax or cerumen back to a point where it can't naturally come out. So you're taking some out, but you're also causing a long-term problem. So we prefer leaving the Q-tips out in the outer ear.
Okay, okay. We were getting a phone call. If you want to call back real quick, Doc, we'll take that phone call, 593-7181. But you got to do it right now. Give us a call. You will answer your questions out there. Yeah, Q-tips have been brought up before by other doctors, and the same thing. You don't want to go back in there.
Right.
Hi, you're on the air.
Hi, Dr. Papsidero. Pat.
Hi.
Hello.
The way he's explaining things to you right now is exactly the way he explains it to you when you're in his office.
Oh, so you're a patient.
Oh.
Yep. I just started a couple months ago.
Okay.
And it's the first time I ever had to go to ENT. But he takes his time and really makes you comfortable while you're in his office.
That's great.
So he gets 2 thumbs up from me.
All right. This is Matt Crawford.
Thank you. That's very nice of you.
Thank you, Matt.
Appreciate it, Matt.
Can't get a better endorsement than that.
I didn't set that up. Yes, I did not. That's my brother-in-law.
That's your brother-in-law, right? You are based all the time out of Ashtabula?
Yes, I'm with the Ashtabula Clinic, which is right at the hospital.
I don't see a number on here, Doc.
Well, if you just actually, I've been there such a only
Short
few months,
period,
so
you don't even know it.
I can't remember the number. I just hit the button and it goes to the hospital, so I apologize. But if you call the hospital, they can connect you with the clinic and.
Okay.
And
so you have all your facilities there. They can go right. That's where they would be treated.
Absolutely, yes.
Excellent. I think this is a great service for ACM.
Well, thank you. I enjoy it.
I hope you enjoy the town. I hope well, of course, you're used to Cleveland weather. You know it.
Yeah, the weather is. I'm not coming from Miami.
No, this is nothing new to you.
Yeah.
But thank you so much for coming in. Very interesting.
Pleasure, Pat.
I didn't know a lot of that stuff that you brought up today, so it was very, very interesting. And when you come back, bring back another show and tell, because I think that kind of helps explain things.
Okay, yeah, I'd be happy to. Thanks a lot. It's nice meeting you, Pat.
Nice to meet you, sir.